Whether they have the virus or not, H1N1 scares are sending many to the emergency room. Reporter Julia Wong finds out when you should visit the ER and when you should stay home.
Dr. William Conrad is an emergency physician at Providence Little Company of Mary. He says the emergency room has become crowded with patients worried about H1N1.
They're simply frightened by the aspect of having this influenza illness. We see a wide variety of patients. We see patients that are very healthy and are just more concerned about their well-being, and we see patients that are very, very ill.
The emergency room used to see around 2 flu patients a day. The number rose to 22 a couple weeks ago. Now that number is slowly going down, but the hospital is still seeing more flu patients than it normally does than during a regular flu season. But Dr. Conrad warns not everyone with flu-like symptoms, such as a fever, chills, cough, and congestion, needs to go to the ER.
Most people that get this illness will actually recover just fine without the help of a doctor, without any medications.
But there are some symptoms that should signal a trip to the doctor.
Symptoms that are more serious, like headache, severe nausea and vomiting, if they have chest pain, abdominal pain, if they have shortness of breath, if they have symptoms that get better for a while but then get worse again, these are all signs that they should come seek the attention of a doctor.
Dr. Conrad says it's hard to know if we've reached the peak of the H1N1 cycle, but with the holiday season upon us and more people at the mall and at parties, the H1N1 virus may spread.
In such an environment, it's more likely that the virus can spread easily, so we might expect to see more and more cases.
That's why Little Company of Mary has an emergency response plan in place in case the number of H1N1 patients surges.
Basically a separate area where we could take flu patients and treat them and give them the kind of care that they would get in the ER while not having to expose everyone else in the ER to their germs.
The plan will be implemented if the ER becomes too crowded with H1N1 patients. Fortunately, hospital officials don't anticipate they will need to use this emergency plan. For Torrance City Cable 3, I'm Julia Wong.
Thanks, Julia. Some other tips to keep yourself healthy: avoid touching contaminated surfaces, be sure to cover up when you cough or sneeze, and of course, wash your hands frequently.